Hey guys, Dr. Q here, and I've been wanting to make this video for a long time because one of the things that I get often are calls from patients' families of loved ones that say, "Hey, I have a loved one who was recently diagnosed with prostate cancer," or a friend of the family calls me, "I was recently diagnosed with prostate cancer. Tell me what this means." And so, if you have recently been diagnosed with prostate cancer with a biopsy, or if you know someone who has, let them watch this video because I will explain how the Gleason scale works, what it means, what the prognosis is. First of all, not all prostate cancer is created equal. There are basically three categories of prostate cancer. You have your low grade prostate cancer, which is non life threatening. You have your intermediate grade prostate cancer, which can go either way. And then you have your high grade prostate cancer, which is definitely life threatening and should be treated. How this all works is there is a grading system for prostate cancer that a pathologist by the name of Gleason developed. And he gave the architecture of what a normal gland should look like and what an abnormal gland should look like. He assigned it a number, and the number is from 1 to 5. And so the most type of gland that resembles a normal prostate gland is a 1. Okay, we rarely see ones. We rarely see ones and twos, really. But for argument's sake, let's just say there's a 1. The gland architecture that looks the furthest away from a normal gland is considered a Gleason 5. That's the worst. It looks nothing like a normal prostate gland. And so you have gradations in between: 4s, 3s, 2s, 1s. Now, there are two numbers that you get when you get your biopsy. The first number represents what the predominant abnormal gland architecture looks like. And that's really going to set the tone for your discussion and your overall prognosis and how you decide to treat it. So say, for instance, he's looking under a microscope and he sees mostly 4s. The second number he's going to call out is the second most common type of gland architecture. He's going to give that a number. And say, for instance, it's a 3. Okay, so that's a Gleason 4 plus 3. That 7 is considered intermediate grade prostate cancer. Now, I'm going to talk about intermediate grade because that's probably the most complicated thing to sort of understand. There are two ways to get to 7, right? There's a 4 plus 3 and a 3 plus 4. I just mentioned that the first number matters the most. So what we know is that if your first number is a 3 and your second number is a 4, even though they both equal 7, it doesn't behave the same as a 4 plus 3. So 3 plus 4s equal 7s are considered favorable intermediate grade prostate cancer. They're not as aggressive as the 4 plus 3s. They don't behave the same. So even though they're the same number, they don't behave the same. I do have some patients that are 3 plus 4s with a very low PSA, pretty benign exam that we have on active surveillance, but that is a discussion that you would have with your physician. Let's talk about Gleason 6s because that's really kind of the most common cancer that we see. Now, Gleason 6s are considered low-grade disease, meaning they are not aggressive, they don't have metastatic potential, they are not fatal. You will not die from Gleason 6s. And so back in my day when we first started, when I first started training, we operated on everything, even Gleason 6s. Well, now we know by research and time that Gleason 6s are really more like a chronic disease. And so you can watch those and you can do an active surveillance protocol, which basically means you are following the PSA every 6 months and getting rectal exams at least yearly to determine the velocity. And if everything is staying normal with your exam and your PSA, then you can continue to watch it. You don't have to treat Gleason 6s. Okay. The only reason I would treat a Gleason 6 is if you had other high-risk features like an intermediate grade exam, or if your PSA was elevated like above 10, then I would consider some type of treatment. Now, as far as the high-grade cancers, which is what Joe Biden has, that's your Gleason's 8 to 10. All those are considered high grade. So if you have a 4 plus 4, if you have a 5 plus 4 or 4 plus 5, or heaven forbid you have 2 5s, which is a 10, that's the max, that's considered high risk disease. And that with that diagnosis, you want to have a metastatic workup. You want to make sure that the cancer is confined to your prostate before making a treatment decision. Now, that's typically involving some type of body scan, like a bone scan, or some type of, I usually get an MRI if it wasn't done beforehand, looking locally to make sure that the cancer has not invaded outside of the capsule or regionally into the lymph nodes. But you also want to make sure it's not in your skeleton because, like Joe Biden in his case, prostate cancer likes to go to the bone. So you want to make sure you don't have any metastatic disease to determine what the best treatment course is for you. So that's Gleason score in a nutshell. Again, not all prostate cancers is created equal. You have low-grade disease, which are Gleason 6s, where we typically watch it. We don't treat it typically. You have intermediate grades. You have your favorable and unfavorable intermediate grades, where both of those you can either observe or treat. And thirdly, you have your high-grade disease, where you want to make sure you don't have any spread outside of your prostate. And you definitely want to have some type of aggressive treatment. My philosophy is that aggressive disease deserves aggressive treatment. So I hope that helps you understand what your biopsy just told you, and that if you have any questions, feel free to DM me. I'm on social media at AskDrQMD. Hit me up on IG or TikTok, and I will help you answer your questions. All right. Hope that helps.